So now we're going to demonstrate placement of the CurvaFix implant in retrograde fashion across the contralateral anterior column for anterior column fixation. So we'll get our starting point. We'll utilize pelvic inlet and outlet views. We're draped out here, so we'll start just over the mons pubis percutaneously in the midline. Excellent. So we're going to be certainly low enough. Shot there. So a lot of times based on patients' body habitus, the retrograde fixation is very difficult, challenging, and sometimes not possible in larger patients if they have very large thighs, if their pelvis is a little seated posterior. But this specimen should do just fine. Shot there. So for your starting point, I'm looking at the dome of the acetabulum, the cranial and caudal borders of the ramus at its narrowest point, which is typically right over the obturator foramen. And I'm trying to line up a good trajectory to get my starting point. Shot there? Great. So I like that on the outlet. Let's check the inlet view. Excellent. So I'll just bring that a touch anterior from where it's at. Shot. Great. So we're just anterior to the symphysis. We'll adjust our trajectory a touch more to be a little more posterior directed. Let's check the outlet. Great, so that looks very good. At this point, we can make our incision vertical or transverse. Here we'll just go vertical, since we don't have a very large. In a larger soft tissue envelope, I'll go transverse. Get our soft tissue sleeve. Give the wire driver, I'm just going to adjust the trajectory a bit. Shot there. And check the inlet. Shot there. Excellent. And check the outlet again. So again, the notches on the opening reamer, we're looking to where those are flush with the near cortex. And there you can see we've crossed, notches are through, so we're deep enough. So we'll remove our starting reamer and guide wire. Place the soft tissue sleeve. So once you have your 2.0 millimeter steerable guide wire, just insert that. Shot. All right, so I like our position on the inlet. Let's go to the outlet, please. And then here we'll start to rainbow back and get more of an obturator outlet view as we cross over the obturator foramen. Shot there. Great. Shot there. Good, so we're just deflecting up that subchondral bone over the acetabulum. Great. So we're up over the dome and we're heading posterior. Shot again. And we'll work ourselves around towards the sciatic buttress. So to get your best ability to steer, if you're buried and you try to turn the handle, a lot of times the steerable guide wire won't go, especially if it's in dense bone. As you're approaching the sciatic buttress, it's the hardest bone in the body. So back it up a little bit to give yourself a little more wiggle room. Shot there. Shot again. And again. This obturator inlet will give us a nice view of the ilium. You'll be able to clearly see the inner and outer tables as we try to pass those over top of the sciatic buttress. Excellent. So now with the retrograde anterior column starting point at the pubic tubercle, our guide wire is up across the sciatic buttress on that left ilium. So now we've got good confirmation that we've maintained our position within the confines of the corridor. This measures a 160, so we're going to put in a 160 millimeter 7.5 CurvaFix implant. So we'll just go ahead and ream with the 7 millimeter reamer. Shot there. And go to the inlet, save that image. Shot. Fantastic. And then the exchange tube goes right over top of the steerable guide wire. And as you place it, it's easier to pass if you rotate driving guide wire. Shot there. Wonderful. And then the 7.5 by 160. And again, these can expand if you wanted to cheat a bit short, up to 8 millimeters. And with the low profile design of the head of the implant, it should sit nice and flush up against that pubic tubercle. So on a retrograde screw, you don't have a big bulky prominence. Yeah. It's always best to have an assistant sometimes to hold your driving guide wire, lest it back out from the vibrations, which can happen. Once you're across that dome heading towards the posterior ilium over top of the buttress, it should start to seat nicely. Shot there? All right. So now we're hugging the inner endosteal bone of that outer table. It should give you fairly good purchase. Shot there. So I like where we're heading here. We're just about there. We can pull out the driving guide wire. And then let's check the symphysis. So just come to a straight outlet, zero out the rainbow, and come a little south. Yeah, almost there. So now our threaded head is really up against the endosteum of the outer table. We've got great purchase. Pretty flush within that pubic tubercle. See if it can get another turn or two. Shot again. Yep, that's as far as she goes. So now we'll lock it. And again, red and unlocked, you have two indicators. You can get your 15 millimeter wrench, and then you just switch it to the green and locked position. And let's take it off. Shot there. Excellent. Save that, and then come to the straight outlet and then an operator outlet. So this is excellent fixation. Sometimes you get a segmental anterior column where you'll have a ramus and then an anterior column acetabulum fracture. You can use a single implant, which I've done, retrograde and antegrade, to fix both fractures with one small incision and one implant. As long as you're reduced and lined up, it goes in without much strain and difficulty, and it gives you very good fixation.